Hello, everyone. Welcome to today's show. On the show, we're talking about the latest in coronavirus news, folks. It is not very good at all. 36,000 more deaths could have been prevented if we had done social distancing early. We're going to break down the new research for you on that, as well as the other coronavirus news. All 50 states have begun to reopen and take a look at how they're going to be handling it. Also, the app culture of delivery apps and how it's demonizing essential workers. Very, very sad. Another media restructuring about what that means for the industry and why you should maybe try and care about it. And also some thoughts about the Democratic Party on today's show. It's going to be a quick one. It's going to be a good one. It's going to be a fire one. It's Newsflash. Thank you so much for listening. All right. So we're talking about this. Let's take a look. I'm going to kind of be quoting heavily here, but this is from the New York Times. If the United States had begun imposing social distancing measures 1 week earlier in March, about 36,000 fewer people would have died in the pandemic, according to new estimates from Columbia University disease modelers. And if the country had begun locking down cities and limiting social contact on March 1, 2 weeks earlier than when most people started staying home, the vast majority of the nation's deaths, about 83%, would have been avoided, said the researchers. So that's a big part. This is the thing that I think a lot of politicians are probably going to try and get and make you think. They're going to lie to you and say, oh, this was all preventable. This clearly, as the research shows, was not preventable. Here, 83, and I really have to imagine there's a bunch of kind of public health experts who are just sitting here, if they're listening to this, if they're reading some of the reporting that's coming out of this here on the New York Times, they're just wringing their hands and just yelling at the computer screen. I told you so. I told you so. I told you so. I have to imagine. I mean, I've heard reports about this, about how these health people, public health people, epidemiologists have just been going up to these leaders, for example, Cuomo and Trump come to mind, and being yeah, people are going to die if we don't figure this out. We need to, this is going to be a big problem. Stop saying everything's going to be fine. Stop saying it's just it's the same as the flu. We need to take this very seriously, and we could have avoided a lot of the deaths that we saw. We really could have avoided a lot of the deaths that we saw, and it just wasn't that reality. So, yeah. If the country had begun locking down cities and limiting social contact on March 1 again, 2 weeks earlier than most people started staying home, and you have to believe there were some people probably begging major officials and them just being yeah, whatever. But 83%, you really just hard to get that number out of your head there. 83% of the deaths could have been avoided. The enormous cost of waiting to take action reflects the unforgiving dynamics of the outbreak as it swept through American cities in early March. And again, they're going to try to tell you that this could have all been avoided. The measures that were taking place here, even in times and even in areas where you thought, oh, these people did a good job, they did not do a good job, and they need to be held to account for this. They need to be held to account for this. For example, but people like Trump, he should get all the worst marks in the world for his handling of this. But again, on the same time, I've been saying this, Andrew Cuomo shouldn't be doing any better. There's been a really great piece about this, for example, in The Guardian, done by Lyda Gold and Nathan Robinson of Current Affairs, about that kind of goes off of a ProPublica piece about all the things that Andrew Cuomo and Bill de Blasio did to kind of screw this up. But it's really kind of infuriating when you look at what's been going on. And sure, other states, for example, like Georgia, who have just been stupidly reopening way too early and exposing their people in a whole bunch of risk. And we'll get to the 50 states and all their reopening plans later. But sure, people have it worse, but in terms of just the absolute battering, the death toll, and the fact that these cities are so close together, there are tough dynamics and tough challenges, especially in New York, the way it's been handled has just been absolutely unforgivable. People would die from this, and Trump's certainly to blame for not taking it seriously. Cuomo, for him, it was just delay, obfuscation, push past bill cutting Medicaid in literally the middle of the pandemic. That is his priorities. That's what he's doing is just using this as a opportunity for kind of toxic his toxic brand of neoliberalism and kind of capitalism to just come in. And now what we're going to try and do is revitalize the New York City public education system. So pretty much try and privatize it. Like, that is what we're trying to do here. And just really kind of exhibit a full takeover of everything public and just ruin the state. It's really, really bad. And it is a big, big difference, as Jeffrey Shaman, a epidemiologist at Columbia and leader of the research team. That small moment in time, catching it in that growth phase is incredibly critical in reducing the number of deaths. So, yeah. The number of deaths that had been reported by May 3rd were 65,307. The estimated deaths if social distancing started 1 week earlier than it did in March, 29,410. So that's 1 week earlier. And if it was 2 weeks earlier, it would have been 11,253. So, yeah, the fact that we didn't do this, we didn't stop at this time, and that area was so critical, especially in New York, was so critical to delay. And people were probably pushing Cuomo day in and day out, pushing de Blasio as well. We need to come in and we need to start thinking about social distancing. It's a serious problem because it all kind of hit that one Wednesday night in March, I think it was March the 12th, where it really, March 11th, no, I think it was a Thursday night in March, where I remember it very, very well. I was driving from New York to Washington, D.C., and because we were going there for a trip, and like I was like, the NBA got canceled. Oh my gosh. Like everything's kind of crashing down. All these sports leagues are falling. Like, this is really serious. But if we had just done that instead of the 12th, on the 5th, if we started really doing this, starting this that weekend, the 12th through like the 16th, if we had started it the 6th through the 9th, instead of the 12th through the 16th, like, we would have had a huge, drastic 40,000 odd 36,000 odd death toll. If we started less of a death toll, we would have started 1 week earlier, and we wouldn't have been a international embarrassment. If we started 2 weeks earlier, and I'm sure there is probably a lot of public health experts saying to do that as well, we would have had 11,000 deaths estimated by these researchers. The findings are based on infectious disease modeling that gauges how reduced contact between people starting in mid-March slowed the transmission of the virus, and they probably just projected that over. On March 16th, President Trump urged Americans to limit travel. That was that Monday. I think on the 13th, he declared it a national emergency, if I remember correctly. Mayor Bill de Blasio closed New York City schools on the 15th, and Governor Cuomo issued a stay-at-home order that took effect on March 22nd. But in cities in New York where the virus arrived early and spread quickly, those actions were too late to avoid a calamity. And again, there is evidence. I recommend you read this ProPublica article about how they have, how especially in New York, this will really piss you off if you're a New Yorker, because you've seen probably, and especially if you live in that lower part of New York, that from like Westchester, Putnam, all the way down to like New York City, the Bronx, where it's been absolutely brutal and so devastating to working class communities as well. And all throughout the lower part of New York, where all the people are pretty much, like, you should read that, because it is just really kind of bad and just disgusting and really hateful the way they both have handled this crisis. I think that's cause for some serious examination that's just not being talked about. Like, Trump, he is really to blame for this national response, but people are actually calling him out on it, like, and they're not writing sexual fantasies about him, even as he does this awful job. So, yeah, the results show that as states reopen, all 50 states have eased restrictions somewhat as of Wednesday. Outbreaks can easily get out of control unless officials closely monitor infections and immediately clamp down on new flare-ups, which is something that they really should do. And as they show, that on each day the officials waited to impose restrictions in early March came at a great cost. Each day that they waited, more lives ended. It's just that simple. That's what happened. So hopefully we learned that lesson. I mean, try to be hopeful at anything, but I guess that's the way it is. Reopening, let's talk that. All 50 states have begun to reopen, but there still are vast discrepancies. In Connecticut, flags have been lowered half staff during the somber peak of the pandemic. They were raised again to signal the state's return to business. In Kentucky, gift shops open their doors. South Carolina will let mini golf, water parks, and amusement parks and other attractions reopen for Memorial Day weekend, said Governor Henry McMaster on Wednesday. And across Alaska, restaurants, bars, and gyms, which have already been seeing customers for weeks, we're getting ready to rev back up to full capacity. It will all be open just like it was prior to the virus. It's making me very skittish, but like, it's really kind of uncomfortable because like it's hard to come in and trust public officials. Like it's really hard to do that. And it's like when we have clear evidence from public health officials, not governors, like that's when I just feel more comfortable. I don't feel comfortable trusting anyone who's elected to handle this the right way anymore, which is really kind of disturbing because like everyone obviously wants to get back up, but you really worry about whether it's safe, and hopefully it is. Hopefully we see a situation like Florida where things have, to the best of my knowledge, have kind of panned out all right, like with the staggered reopening of beaches. So hopefully that pans out all right, but it just makes me nervous to read. As of Wednesday, all 50 states have begun to reopen to some degree 2 months after the outbreak thrust the country into lockdown, but vast variations remain in how states are deciding to open up, with some forging far ahead of others. Many began to reopen despite not meeting White House guidelines for progress against the virus, and newly reported cases have been increasing in some states, including Minnesota and Texas, that are moving to ease restrictions. Public health officials warn that moving too fast could risk more outbreaks. The dynamic have left many business owners and customers to decide whether themselves, like that's the thing, people are deciding for themselves. They're literally taking their lives into their own hands because you cannot trust, and you're getting so many mixed messages from authority figures and people in power that you just can't trust because it's a partisan thing for one side or the other. Like, and obviously you want to rush back, but then you have a whole host of people who are like have the words or the letters DR next to their names telling you that it's going to be better to stay at home. And who do you listen to? Because you get the sense that like there's some people saying it's okay, it's safe. It's really kind of a tough thing to do and to judge because it's just very, you can't help but get the sense that it's like you're taking your life into your own hand. It's a little scary considering we don't know exactly what this is, said Ipakai Grigoriadis, whose family owns Pop's Family Restaurant in Milford, Connecticut. It's down that reopened its outdoor seating on Wednesday morning. Yeah, people, I think, in Connecticut, they're letting outdoor seating happen again. It was quite exciting to see our customers we haven't seen in a while, but it was not business as usual. Pop, like other Connecticut restaurants, now offers only outdoor seating and plans to gradually ramp up to 50% capacity. Servers are gloved and masked, and patrons are expected to wear masks as well, except for when they're eating and drinking. And obviously, the patrons will be playing probably fast and loose with that mask guideline there for sure. In New Jersey and many parts of New York State's reopening has been more limited with curbside pickup at retail stores and allowances for certain industries. Governors are increasingly facing intense pressure to reopen as millions of Americans have lost their jobs. And again, the most, I think the part of this is probably the most pathetic has been the federal government with the kind of lackluster performance by Nancy Pelosi. So much so that we have progressives and swing state blue dog Democrats coming together to agree to try and push Pelosi to the left and try and get her to kind of focus on paycheck protection and paying back people's paychecks and getting them ready to participate in the economy again once things are safe to reopen. Like, that is how bad things have done for Mrs. Trump has poopy in his ass, Nancy Pelosi. Like, so we're really getting a lot from her. Thank you, Nancy. Really appreciate it. You're a queen. But yeah. Coming up next, we will talk about how people are handling this. And folks, it's not good after this announcement. This week, on an all-new episode of That's Interesting, we take a trip down south. That's right, we're heading to Outer Banks, North Carolina, to talk about the Outer Banks. We have a special guest, Tatum Walsh, my sister, is going to be joining us to talk about one of the most popular shows in America. No, we will not be going to Outer Banks in actuality, but we will be breaking down everything from John B. and Sarah, the Kooks and the Pogues, when we're talking about just the first episode. I'm dipping my toe in the water in this one, and you're going to get to watch how this show is going to slowly pull me in. It's the newest Netflix addiction on That's Interesting this week with Tatum Walsh this Friday on all new That's Interesting on Outer Banks